welcome back again to Healthcare Hoax. And this is healthcarehoaxvideos.com is the way that you can find us on YouTube. And remember, if you like us, let us know. If you like us, even better, share with your friends and family about these videos. Once again, I'm Janet Cimorelli, nutrition counselor, and I want to tell you about how we're going to present our health information to you so that you know that possibly you've been led down the path of healthcare hoax instead of true health care. And each week we're going to be day by day bringing you a new video every day, and the first video is going to determine the subject that we'll be discussing for that week and to expand on how you might be diagnosed with a particular situation, just give you an overview of the subject. And so, doing that overview, you'd have a greater understanding about this entire picture. A picture that you might be given very, very little information. I kind of do this, telling people, well, when you're going mainstream medicine, you get that kind of a vision of your health challenge. And so doing what we're presenting here on healthcarehoaxvideos.com, doing what we're talking about will give you a much broader view of the subject.
Doctors are trained in hospitals.
That's true.
And that's part of the problem.
And in classrooms. And who funds those
Well,
classrooms?
the drug companies. But the reason I mentioned doctors are trained in hospitals is because their frame of reference are always sick people.
Wow, true.
So when they see someone walking around outside the hospital, they don't know what to do with that patient, because from their frame of reference, those people are healthy. They're not in the hospital. So if you ask a doctor, what's the definition of health? It's the absence of disease.
Or not in a hospital.
Right. So that's the problem. They're trained. So when you get sick enough to be in a hospital, the doctors know what to do for you. And I'm not in disagreement with what they do, because frequently these are life-threatening emergencies.
Absolutely.
And you want to save lives, and we're good with that. What we're talking about, and what the hoax is that you're not being told anything about how to avoid going to the hospital, how to stay healthier, so you don't have to deal with these emergencies.
I certainly am very much of the opinion that you need to know exactly what you're dealing with, and you need to know information about how you got to this particular aspect with regard to your energy isn't so good, you're not sleeping very well, you have a headache every day, your joints hurt. So all of those different situations have very specific causes. Sometimes the causes are overlapping, but they have very specific causes. And unfortunately, instead of investigating what that cause is, that's when you are kind of moved in the path of pharmaceutical, possibly something more significant, maybe some tests that tend to be invasive, a variety of approaches that might not necessarily get you to the real cause of your health challenge.
The way people respond to those symptoms, like a headache,
Yeah.
immediately they think of an aspirin deficiency or Tylenol deficiency or Motrin deficiency, because they don't really understand that that's a symptom of perhaps a more serious problem, not right away, but ignored by taking a drug instead of addressing the underlying cause, could lead to problems, more problems down the line, and that's what we're talking about. Now, I mentioned earlier that doctors are trained in hospitals, and in hospitals, they basically do complete blood counts and serum chemistries on people, to monitor their life-threatening condition. They don't get into the kind of testing that would identify underlying problems that are at that time what might be asymptomatic. But they carry the same practice when the patient leaves the hospital. So when you go to the doctor's office, he does the same tests, a complete blood count, serum chemistries, because what he's trying to determine is, are you sick enough to be put in the hospital? That's his frame of reference. If you're not sick enough to be in the hospital, he feels you're fine, you can go home, he'll prescribe some drugs for you, and he can usually do that in less than 5 minutes. But that's the hoax, because you leave that office thinking everything is fine, but he hasn't tested for anything. And that's the kind of information we're going to help you understand so that you can take better preventive care.
So week by week, we're going to introduce a subject, then we're going to give you information about the causes, and that you might not necessarily know that there are tests that will identify nutrient deficiencies. They'll tell you what your zinc level is. They'll tell you what your fatty acid status is. They will tell you about coenzyme Q10. Those tests have so many different areas that can be investigated. And then with the help of a trained physician, trained in functional medicine, that kind of functional medicine that is supportive of good health rather than treating a disease. So there are so many infectious microorganisms out there. It isn't just a certain type of bacteria or a certain virus. There are myriad different pathogens that can affect your good health. And those need to be identified because not everyone is going to succumb to an antibiotic or an antiviral approach. So you need to know what you're fighting in order to successfully overcome it. And that's what we are about here on the Great American Healthcare Hoax. We are healthcarehoaxvideos.com.
And Janet, you brought up an interesting term there of functional medicine. And mainstream medicine is really black and white. You're either healthy or sick. But there's a big area in there between healthy and sick. You know, you can have good function or bad function.
But still be functioning.
And we're talking about that big area of dysfunction. In other words, your body isn't functioning optimally. You have no symptoms, but it's only a matter of time before the symptoms occur, and that's when your doctors are ready with the prescription pad. And what we're saying is there are ways to identify that dysfunction, not only with tests. You can do tests that identify levels of inflammation or elevated insulin levels, which aren't being tested often enough, or as Janet just mentioned, nutrient deficiencies. But a lot of these problems can be identified just by talking to the patient. And I think that's been lost also with healthcare, the way it's practiced now. That doctors are treating paper, in other words, the lab results, and not listening to what the patient has to say. And that's another problem, because if you actually have to talk to the patient, you have to spend time with them, get to know them, and see what they're feeling. Just don't go by lab tests, because I have to tell you, labs make mistakes very often, so you're going to run into trouble if you always treat patients by a lab test.
So you've been listening to healthcarehoaxvideos.com, and we'd love it if you let us know you liked this video and that you are going to be tuning in on a regular basis, as well as liking the videos and sharing them with your family and friends. Until next time.